Welcome once again, friend, to the most commonly repeated one-liners in ENT. Today we will discussing the part 23rd of the series. So, beginning with today's series, the question number 1, which says that the treatment for rhinitis medicamentosa. We all know that the most common drug that is responsible for rhinitis medicamentosa is xylometazoline. Excessive use of xylometazoline nasal drop. So, when it results into the rhinitis medicamentosa, then what will be used as a treatment modality? So, there is a simple treatment for rhinitis medicamentosa, that is the short course of topical steroid. That is, we can use the inhalational or spray form of the topical steroid. Now, going to the question number 2, we say that most common organism causing acute sinusitis. So, we have to remember that is SP or ASP, acute sinusitis, that is Streptococcus pneumoniae. That is the Streptococcus pneumoniae is the most common organism. Going to the question number 3, which says that sphenoid sinus pain is referred most commonly to. This is a tricky question. So we have to remember it. That is the sphenoid sinus pain is referred to occiput. Where? Occiput. That is OCC, occiput. This is very tricky question, so we all have to remember this. Question number 4, which says that pathognomic feature of chronic maxillary sinusitis is, that is, mucopus in the middle meatus. If we go for a diagnostic nasal endoscopy and we find the mucopus in the middle meatus, then that will be pathognomic feature of chronic maxillary sinusitis, because that's the drainage area of the sinus. The question number 5, which says that Cardwell view is done for. The Cardwell view in X-ray PNS form is usually done predominantly to see for the frontal sinus. That is for the frontal sinus. That is CFR. In the frontal sinus, we have the Caldwell or frontal sinus. So this concludes the question number 5. We will see other sinuses also, but it's predominantly for frontal sinus. Going to the question number 6, which says that most definitive diagnostic for the sinusitis. This is the most definitive investigation for sinusitis. So the most definitive diagnostic is the nasal endoscopy. We cannot say definitively in the X-ray, we cannot say definitely on the CT scan, but when we will see by themselves the sinusoidal changes in the nasal mucosa as well as the mucopus inside the nasal mucosa, we can definitely say that it is a case of nasal sinusitis, and also through the DNA we can rule out other causes. Question number 7, which says that FAS mean. So you will think that this is a silly question, but many times students forget to learn the full form of FAS, and this is most commonly asked question in NEETPG as well as the normal third year MBBS exam. Then the full form is, for F it is functional, for E it is endoscopic, S for is a sinus, and S is a surgery. That is functional endoscopic sinus surgery. So you should remember this. Question number 8, which is that sinusitis most common complication. So the most common complication of sinusitis is orbital cellulitis. Which is the answer? The answer is orbital cellulitis. SOC. The most common complication is orbital cellulitis. Question number 9. This is related to question number 8. The orbital cellulitis, as we asked in earlier question, it was the most common complication of sinusitis. But if we ask the question more specifically, with which sinus infection orbital cellulitis is most commonly seen, then the answer will be the ethmoidal. If all the sinuses are given, then out of them the ethmoidal sinus is most commonly associated with orbital cellulitis. This is orbital cellulitis. Question number 10, which says that in Caldwell-Luck operation, the nasoantral window is made through. So this we have to remember that in Caldwell-Luck operation, the nasoantral window, the nasoantral window is made through the inferior meatus. The right answer here is the inferior meatus. So this concludes our part 23. Total involved is 230 question has been covered from the ENT, and these are the most common questions which are most commonly repeated, which has been represented in these series through a simplistic way that is easy to understand as well as to remember on later on. So kindly go through all the parts before your NEETPG exam and stay tuned for more such parts which are on the way. Thank you. If you like the video, kindly share and subscribe.